Hello everyone, welcome to iCare. Today I'm going to discuss about contact lens fitting. When it comes to contact lens fitting, we have two methods. One is empirical fitting, second one is diagnostic fitting. Both the methods are based on total diameter, keratometric reading, back vertex calculation and manufacturer guidelines. In empirical fitting, we'll prescribe the contact lens power without any contact lens trial. But in diagnostic fitting, we'll prescribe the final contact lens after a contact lens trial. In practice, this diagnostic fitting method is followed as a standard method for contact lens fitters. For a soft contact lens fitting, we need to check for three key elements. First one is pre-evaluation, that is baseline measurements. Second one is trial lens selection. Third one is fit assessment. In this video, we will be discussing about pre-evaluation baseline measurements of soft contact lens fitting. The first one is slit lamp examination. This is to identify any pathology in anterior segment or in eye adnexa. We should check for eyelids, bulbar and palpebral conjunctiva, cornea, anterior chamber, iris, lens and tear film. The second one is HVID, horizontal visible iris diameter. This is important in contact lens diameter. Normal average HVID is 11.7 mm. This can be measured with normal millimeter scale or slit lamp or corneal topographer or vernier scale. Total diameter for the soft contact lens will be HVID plus 2 mm. Third one is palpebral fissure height. This is basically vertical distance between upper and lower lid margin through the central cornea at primary haze. Average normal height is 10 mm. This can be measured using millimeter scale, slit lamp or corneal topographer or with a vernier scale. This measurement also helps us in deciding a diameter. If height is higher, we can go for a higher diameter. If it is lower, we can go for a lesser diameter lenses. Fourth one is pupil size. Normal pupil size in bright light is 2 to 4 mm. In dim light, it is 4 to 8 mm. This pupil size is important to identify the optic zone in contact lenses, and also this should be checked in dim room illumination. Optic zone will be calculated as a pupil size in dim light plus 2 mm will be added into that. Fifth one is keratometry. This is to identify the base curve of contact lenses. Base curve is equal to 337.5 divided by D. Here D is average dioptric value. Sixth one, we have some additional tests like tear film evaluation. We can check with the Schimmer's test, debut with invasive or non-invasive technique, tear meniscus height, and one more iris color. This will help us for a color contact lenses. Okay guys, we'll see the next part in following videos.